Sexual and reproductive health education is essential in empowering young girls, reducing teenage pregnancies, and promoting overall well-being. However, access to these services remains a challenge in many rural areas of Ghana. The Campaign for Female Child Education, CAMFED, has called on the government to take urgent steps to improve sexual and reproductive health education and services in rural communities. The organization is advocating for increased budget allocation to support these services, as well as the provision of accessible and affordable healthcare facilities in underserved areas. Additionally, CAMFED wants the Ghana Education Service to integrate sexual and reproductive health education into the national curriculum. The group also urges parents and NGOs to support the initiative and help eliminate stigma preventing girls from seeking education on reproductive health. Executive Director Faieuza Abdul Rashid Safian made these remarks while presenting CAMFED's findings from studies conducted in 5 regions and selected rural communities.
CAMFED Ghana, with support of our lead consultant, Trend, has conducted a scoping study into sexual reproductive health in some selected regions and communities in Ghana. What is coming out from the study is that there's a lot of misinformation out there, and the fact that people are not even aware about the policies Ghana has on sexual reproductive health. We still have issues of cultural practices and norms that are against even discussing sexual reproductive health at home, and against school children being taught about sexual reproductive health. A lot of information that is being shared among peers that are not very accurate on where to even access sexual reproductive health information, how to go about supporting themselves as individuals. A lot of misinformation and misguidance out there. And we feel that this study is one of the things that would unearth what is actually out there to support what the government and development partners can do to ensure that young people are adequately informed and they know where to seek for support when they need one, so that we would have a very just community with children that would have all the needed support they need to develop themselves sexually. We are not trying to expose children to sexual activities, but trying to make children understand that there are services that are available to support them to understand their own development, so they don't go exploring and then fall victims to sexuality issues in their communities. We have very beautiful policies in Ghana on SRH. What is missing is adequate resourcing to give out information to whoever needs it, and then also the implementation of whatever interventions that are being covered in the policies. So I would say that the government, development partners should all come together to ensure that we give SRH the needed attention to curb some of the social vices that we are experiencing in the country.